The first thing to appreciate about prostate cancer is that you may have no symptoms at all. In other words, nothing problematical with how you're passing your urine. Having said that, there are certain symptoms that indicate a urinary problem, which could be due to prostate cancer or could be due to the ordinary swelling of the prostates that happens in men as they age. So what are these symptoms? Well, the symptoms, for example, if your urinary flow becomes slower than you're accustomed, or it takes you longer to empty your bladder, or there is a delay before your stream starts flowing, or dribbling at the end of it. You may experience having to go more often, more frequently to pass your urine. You may find yourself having to get up at night, perhaps 2 or 3 times. You may also find yourself having to get to the toilet in a hurry. So I'm not saying that these symptoms mean you've got prostate cancer, but what I am saying is that if, as a man over the age of 45, you have some of these symptoms, then it's worth getting checked out. Other things can be responsible, such as urine infection or inflammation of the prostate, or a stone in the bladder, or the swelling of the prostate that happens as you age. But these symptoms could also indicate prostate cancer. That's why you need to get them checked out. So in terms of whether these symptoms are constant, the answer to that is not always. So you can have a period of time when your flow is disturbed, and then it settles down, and then it flares up again. So the symptoms are not necessarily constant. In terms of where does prostate cancer spread to, if it is going to spread, it tends to spread to the bones. Indeed, one of the presentations that we see is an older man with sudden onset of severe back pain. So prostate cancer can spread to the bones. It can also spread to what we call the lymph glands. And in advanced stages, it can spread to the liver or even to the brain. But primarily, it is the bones. There are several treatments. The treatment depends on the stage of the prostate cancer. That is to say, whether the cancer is confined to the prostate gland or whether it has spread into other parts of the body. Now, if the prostate cancer is confined to the prostate gland, and we can tell this by an MRI scan, there are various ways of dealing with this. I wouldn't say that there was one best way. There are a variety of equally good ways. So the man and the urologist and the oncologist have a choice. So one of the treatments for prostate cancer that is confined to the prostate is an operation that we call a radical prostatectomy. This is removing the prostate gland in its entirety. Nowadays, that's done with the assistance of robotic technology, and it is an abdominal operation. Another equally valid treatment for prostate cancer that's confined to the prostate is radical external beam radiation. This is a course of treatment over 4 to 6 weeks, whereby the man attends daily to the radiation center and has radiation directed a small amount at a time over a period of weeks. So that destroys the prostate cancer without actually having to physically remove the prostate gland. Another equally valid treatment is what we term low dose rate brachytherapy. So this is a treatment whereby as a day case under an anesthetic, the urologist would insert tiny radioactive pellets, radioactive iodine pellets into the prostate gland, where they lodge permanently, and over the course of 6 months give off their radiation, and again that destroys the prostate cancer. So I wouldn't say that one is better than the other. One maybe more suitable for a man than another treatment. So those are the mainline treatments for organ-confined prostate cancer. Now, if the prostate cancer has spread perhaps into the bones or the lymph glands or elsewhere, then there are treatments that can keep that prostate cancer under control for a period of time. And I'm talking primarily about hormonal treatment. So there are drugs which, if you inject perhaps every 3 months, will reduce the testosterone, which will reduce the prostate cancer and keep that under control. If those hormonal drugs don't work, there are other second line and indeed third line agents that are good and effective at controlling the prostate cancer for a period of time. Another issue that comes up in terms of dealing with prostate cancer is that men often ask, is there anything that they can do to reduce the risk of the prostate cancer coming back, or to improve their chances of successful treatment? And I say there are various things that you can do. So attention to diet, I think that's important. So essentially reducing red meat and increasing fruits and vegetables. That does seem to be of benefit. Also, it is important to keep one's weight down. So we know that men who are overweight tend to fare less well in their prostate cancer journey. Also, exercise seems to be of value. So I would encourage men to get daily exercise. And we also think that sunlight, by creating vitamin D in the man's skin, is of value as well. So if you're one of those places where there's not much sunlight, then perhaps the man could consider vitamin D supplementation. So attention to what you eat, exercise, keep your weight down, and sunlight. And I think that gives the man the best chance of dealing with their prostate cancer.